A lot of things happen, and people don't understand why it happens, and what they assume is the wrong thing, because there's a lot of wrong assumptions for people who are managing diabetes, and a lot are falling into victims of ignorance. Okay, I keep saying it and I cannot stop saying it. Always visit your doctor, do a test, and find out if you're diabetic or not. Once you are diagnosed and you find out that you're diabetic, I think your doctor also is going to put you on medication regime. Okay, when you're on medication regime, that means the management of your diabetes has started, and you will be told how many of those medications you take per day, when to take them, with or without food, or with or without water. But most of the time they tell you to take your medications with ordinary water. You don't have to take it with soda or any other tonic water. So it's all depends. They're gonna tell you what to do. And again, I think the doctor is gonna encourage you to have what we call sugar blood test kit in your house, so that you do in the morning before food. It's called the fasting test. You have to know how to measure it. You have to prick yourself and then measure the blood to know how much sugar it contains. That's what is called blood sugar test. And the doctor is going to tell you when it's up and when it's down. I'm not going to be telling you that now, but it's for you to see your doctor and make sure you are doing the right thing. All right? Why must I do all these things? Because diabetes has a lot of complications. Okay? A badly managed diabetes is might cause you to lose so many things. Okay? It might damage your organs. It might damage your eyes. It might damage your nerves to the extent that you have amputations sometimes. So you're gonna be very, very careful in managing your diabetes. You have to religiously follow it. You have to check the kind of diet. Myself, I use medications and diet. All right, I use medications and diet to follow mine. And this is one of the things that you have to discuss with your doctor. Do you have to treat it alone? Do you have to, treat it alone with medication? Or do you have to treat it with medication and diet? Or do you have to use, not even ordinary tablets, you have to use like insulin? All right, when it gets to that stage, depending. So, it is very, very important that you take the management of diabetes very religiously. I have seen many people who take it for granted, and at a point, they find it difficult to use the toilet. Constipation becomes a very great hurdle to pass through. You can no longer, have it easy in the toilet. Whenever you go to toilet, it's like a tug of war. You cry with tears rolling, streaming down your face. You will, like calling out people to help you because you can't. Sometimes you say, take me to hospital. That is constipation. And it's just because of poor dieting and poor management of your diabetes. So you need to know, what kind of food should I eat? What kind of diet that will make it easier for me to, use the toilet? Then again, sometimes is not, you have the frequency of urination becomes so high. Sometimes in the night you urinate about 5-6 times, and at the moment you're urinating, you're also very thirsty of water. You want to want to drink water. Your throat is so dry, you feel as if you want to collapse. You feel so dehydrated. So you have to keep yourself hydrated once you see those signs. All right? You have to go for regular eye tests to make sure that you don't have glaucoma or you don't have anything, diabetes related eye issues. You might be saying, oh, okay, it's so expensive. I don't know. Maybe I'll use herbs. If herbs works for you, that's yours. I'm not gonna tell you what to do, but for me, I use orthodox medication. I follow it to the letter, and I use good dieting. I have to learn how to prepare certain meals to help me, soften my stool. Make sure that I don't have constipation. Make sure that I am not dehydrated. So there's certain type of diets will keep me going, make me have that energy to go. And when I take my medications, I keep on top of it. All right? I keep on top of it. So, I don't know what to say, but the thing is, there is no straight line to it other than to make sure you are supported by your physician. Sometimes your fingers, they used to call it a neutropathy. Your fingers feel so, kind of, you don't get blood flowing into it, as if you are losing it. Okay, so those things are maybe for the fact that your blood is not circulating very well. There are medications for this to put you right back again. You can, of course, your doctor can prescribe so many medications for you. The one that, at least in the morning when you wake up, every part of your body wakes up, including, whatever area of your body, you won't find out. I know you won't see any kind of numbness. You won't see any kind of tickling. Yeah, that's the reason why you should go and see your doctor. Very, very important. Self-medication is very, very dangerous. I never did it in my life. I've been diabetic now for so many years. Someone will ask me, oh no, so somebody, an uncle of mine did this and is out of, he's no longer suffering diabetes. You can do it. That's fine. That's good. I'm not objecting that. I'm not. If I see such medication by my doctor to clean up my type 2 diabetes, that's okay. Okay, mine is not insulin based. I take my medication and I use the dieting. All it does is sometimes now you lose a certain weight. But I used to be a big guy before, but now I've lost weight. But that weight I lost actually is in good faith, because at the end of the day, it helps me to keep my body in shape. Okay, according to my age, because I'm aging. I'm no longer a young man, so I need to respect what I eat, what I drink. Yeah, if you take alcohol, that's fine. That's your choice. I don't take alcohol myself. I stopped about that 5 years ago. I don't smoke. I stopped about that 5 years ago. That's fine. That's me. That's not you. So if you want to continue to do that, that's fine. If your doctor says it's okay, that's okay. If your doctor says stop, please stop. If your doctor says stop smoking, please stop. If he says stop drinking, please stop. You cannot tell me you know more than your doctor. No. Your physician knows why he's telling you, don't do this, don't do that. But the practical experience I have in my own is just making sure I follow the medication prescribed to me. making sure I follow some strict diet, programs, and a healthy lifestyle. I make sure I walk around and do exercise. Each day about between 9 and 11,000 steps. Okay, and then consistently every day. I don't do some exercise that is so difficult and so hard for me. I can no longer do it. I used to be a black belt, karate black belt, and so many other martial arts. I do judo, I do taekwondo, I do karate, I do a lot of street martial arts, disciplines. And as I grow older and older and do those things, it's just to keep me. I do it in a very, little manner. I don't do it in such a way that it will put me into, fatigue. Because to recover from all this, any fatigue, the body, it's no longer easy. When you are younger, it could take you, when you are fatigued, it could take you like 5 to 20 minutes to recover. Once you sit down in one place, breathe in, breathe out, breathe in, breathe out, you're okay. But by the time you cross 50, 55, 60, going forward, you see that sometimes it takes you like 2-3 days to recover. So you take it easy. I know the kind of, exercise you could do. If you are 60 and you feel you can still play football, you can do it. If you can go to gym, you can do it. Once your body allows you, you can do it. But bear in mind, if you are managing diabetes, make sure you do everything with the support of your doctor. All right? There are ways to monitor yourself. There are ways he will, direct you to actually exercise, eat, have a healthy lifestyle. Yeah, there's so many things to talk about diabetes. Believe you me, that's why I want to. If you have not subscribed to this channel, please do subscribe. Do like it. You can share. You can also press on notification button. That will help us to always bring all these things to you. Okay, my life experience can help someone. This is just a practical life experience. It's not about what I read or my profession. No, this is practical life experience of someone who has been diabetic for over getting to more than, I think, up to 3 decades. Okay, so someone might tell you, oh, if you are diabetic, you are done for, you are on it. No, you are not. You can do everything that a man does or a woman does, or just anything any person can do. You can do it, but with a very good support of your doctor. You don't overdo things. All right? Yeah. Someone told me, he said, oh, Patrick, you see, I'm diabetic and I've not been able to perform as a man. You can perform as a man. Speak to your doctor. All right? Everything is possible with, the support of your doctor. All right? So diabetes is not something that is unmanageable. No, it's manageable. Very, very manageable. Okay? Yeah, you might have some symptoms. You might have sometimes joint pains, sometimes kind of tingling, numbness, going frequent urination, constipation, and all that. But all of them, all the symptoms are, manageable. And as long as you continue to take your medications, you overcome. you will lead a normal life. Every day it will help you. Don't allow it to degenerate to the extent that you will now be insulin. If you don't take insulin, you can't do anything. From there, you might not be able to manage it. But if you still have strict discipline, you can manage your diabetes with insulin. No problems. No problems at all. So it's very, very important that we get our act together and do what we're supposed to do. All right. So some people are, I'm just putting all these things together. And there are a couple of questions I got from, people that some people say, oh, if you're diabetic, does it mean you will lose your eyesight? Listen, I started using glasses from, very early age. So it's not actually diabetes that, happened to me, And this one is for reading. I can go without glasses and I see very far, up to 400 meters. Okay, so this one is for reading, is reading glasses. As long as you keep to your medications and you do and keep yourself hydrated, you're not going to have eye issues. I mentioned it earlier of constant eye test. So you do constant eye test to see how it goes and everything. All right. And then there are so many things you have to improve on your personal hygiene, because when you have diabetes, you seem to have dry skin. Okay, so yeah, you see your skin peeling off, but not mine anyway, because I take care of myself. But if you don't, then you can see dry skin, so dry that you'll be scratching, and it will be peeling off. Okay, all over your body. So you have to keep an eye on to that. Also, you have to keep an eye of dehydration. Like I said, when you watch your lips now become so dry and everything, then you have to take water. Always take water. Take water. Don't flood yourself with water, but at least take water, enough water. Okay. Then once you do that and get the right medication, you are not going to go blind. Again, I see people asking me, oh, Patrick, I saw people on the internet, they got their legs amputated and this amputated because of diabetes. Yeah. No matter who you are, even if you're a celebrity or you're a very popular person or you're a public person or you're just a private person, once your diabetes was not diagnosed on time and is not managed properly, those things can come up and you have no choice to amputate that leg. Okay, so one of the things that can cause that, apart from the fact that you have blood clotting and you have injuries, maybe wounds and everything that refuse to go away. Once you detect and you are diagnosed of diabetes and you have an injury, no matter how small, and you feel this actually bleeded a lot or something like that, go and see your doctor. I didn't say just go and buy over the counter something and begin put plaster. Go and see your doctor. Have yourself checked if you are not diagnosed and you see that you urinate frequently, maybe more than twice a night, and while you are urinating you feel so thirsty, you want to drink, have yourself checked. It's not difficult, very easy to check if you are pre-diabetic or diabetic, if you are type 1, type 2, whatever thing it is, just check so that you know how to handle yourself. If it's a question of you are having issues with your blood is not flowing very well everywhere, then the doctor is gonna give you medication to ease it. Then if at the end of the day is to save your life, is to amputate that leg or whatever, it's down to the doctor. Okay, but in most cases, from what I know, all right, from what I know, is poor management of diabetes. I've had the issue of I've had instances whereby I have like that tingling on my foot, and then have it immediately. I'll rush to see my daughter, say, look at this, look at that. Because sometimes people don't even know. In the hospital where the doctors know about diabetes, they have a lot of tools to check if your body is actually breathing, like your food and everything. If there is no poor circulation, they're gonna find that. But if there is good circulation on your foot and everything, you're not gonna have any issues with a neuropathy or anything that is gonna make gonna make your nerve breakdown in those areas. So you're not gonna have those issues. But speak to your doctor. Speak to your doctor. Tell him how you feel. Or suddenly your food can no longer digest. Or sometimes you sleep at night and you have reflux. That is so disgusting. Sometimes if you have a partner, your partner might complain because you wake up in the morning, your mouth is smelling so terribly to the extent that it's so disgusting. So your doctor is going to suggest to you how you will sleep without having that reflux, how you will, like oral hygiene is mostly recommended in this one. So you have to brush your mouth, brush your teeth, and then rinse your mouth before you sleep. And then maybe I don't know, the position that your doctor will suggest to you. And then you will see those acid reflux will reduce, and then you will live more happily with yourself and then your partner. Because what diabetes does is so many things. If I begin to list here, is so much. So most of the time you have bitter taste in your mouth, as if maybe you have the taste of rusty iron and everything. That time is very, very dangerous. Maybe your organs are beginning to be affected. Because poorly managed diabetes can actually affect your organs and you lose them. You begin to have kidney issues, begin to have liver issues. A lot of things. So it's not about scaring you, but it's about creating that awareness. It's about educating you. It's about making sure that you know all these things, and when you see them, you cite them, and say, oh, yeah, I know. This is, I know how this is going to be. Let us see the doctor. Let us handle this differently. Let us begin to tackle it before it gets bad. If you manage it well, it's not going to condemn your kidney. It's not going to finish your organs. You get yourself back. So many things. You can't be going on and say, when your mouth is dry, there's no way you must have bad breath. And these are things that, diabetes cause. Okay? So diabetes, not only diabetes, a lot of sickness, but at least diabetes, because it makes you dehydrated, and then you have dry mouth. And once you have dry mouth, you about to have bad breath, and then that could be affecting you. I wrote a book on that, but that's not what I'm here for. It will begin to impact on your social life. Now I'm gonna say all these things once, break them down, because this is a whole volume of talk. So that affects your your social life. You don't want to hang around your friends because you don't want them to say, oh, he has a bad breath or this and that. There's so many things you can do to mitigate that. Again, your social life can also be impacted if you have incontinence, that you seem to lose it by the time urine dropping before you get to the toilet. You soil yourself before that time. Before you think about getting to the toilet, already it's dropping on you. There are ways to do that. I know someone will just say, oh, we are a secret pad or the shots that have. Yeah, but you also can manage that to the extent that you won't see that incontinence. You won't see it. It's not going to happen to you. There are simple techniques. Your doctor will tell you. But one of the ways, myself, when I noticed such a thing years back, is that I will frequently visit the toilet even before it comes into my mind. I don't need to feel pressed. I just go to toilet. I time myself. I say, okay, I give myself every 25 minutes. I just have to go to toilet and do it. It's so difficult, but by the time you do that, your brain, everything will be, will be kind of recalibrated, and then you begin to go to toilet, space out some time. Instead of 20-something minutes, you can make it 1 hour, 2 hours. From there, you train yourself up to, so many hours. Why the doctor will prescribe some medication, some ways again, how to help you deal with that. But if you feel that the best way for you is to wear such, pads and everything to help you out, go ahead with it. Don't feel so bad. You are not the first person. You are not the second person. You won't be the last person. Okay, there are so many people suffering from diabetes, and they wear certain clothes and everything, and that doesn't disturb their daily life. Don't allow yourself to sink in because of this. It does not disturb you. Go ahead. Do your thing. Enjoy your life. When you get to that party, right? When people are drinking their beer or whatever, all the drinks, you take the one you can take. The one that will not spike your sugar. The one that will not kind of disturb your normal nature. The one that will not make you force you to, maybe instead of going to toilet 2 times, you're going to toilet like 5 times within the period you are having that socialization. So watch it and make sure that you don't overdo. All right? Do things the way you feel you can handle it. Do things the way you feel you can handle it. All right? Then when you are going out, make sure you wear something that is not so tight. All right, to allow free flow of blood, and just to make sure that you don't get cramped or anyway. A whole lot of things that I can, it's written in my book, but a whole lot of things that I can mention here to help you. Okay, I can also mention 1 or 2 things you have in your kitchen that are very dangerous for you to use as a diabetic patient. I can also mention some things in your kitchen that you think that is useless, but is so important, and it can help to manage your diabetes in conjunction with your medication by the doctor. A whole lot of things, right? So that's why I said don't cut the video, just continue to I'm gonna break them down Once in a while, don't worry, I'm doing this long video, but from time to time, I'm going to break it short, segment by segment, explaining to you, how to, like, would I say home remedies or some remedies with my experiences that can help you manage your diabetics. Okay? And that is in conjunction with the medication prescribed to you by the doctor. Okay? Myself, I use some medications every day, and then I use also dieting. So I don't use insulin yet, and I've maintained a very low blood sugar level for many years. Okay, so you can see that I've done a lot of topic here. I've talked about how to get a diagnosis, that is by getting to the doctor. I've talked about the necessity of treating yourself by yourself. The danger of treating yourself by yourself. Self-medication is very dangerous, so you need to get treated by the doctor, qualified doctor, who is giving you prescription and making sure that their diagnoses are right. You got to know if you are type 1 or type 2 or pre-diabetics. Okay, you can't get it from packs, so you need to get it from a qualified doctor. Those of us in the Western world, you cannot get this. There's no quackery here. But if you are in a place or in a country where such people are around, where they can, call themselves doctors, they are not qualified doctors, and they want to treat you and say, oh, you're having this, be careful. Be very, very careful. All right? Very, very careful. Don't put yourself in danger. Don't put yourself in danger. Go to the hospital, especially a public hospital run by the government, if you are in such countries. Okay? So get yourself diagnosed, start your treatment regime, and follow the process, and get yourself in a good and better position to live longer, to survive the menace of diabetes. If you take it if you take it so simple, as if maybe it's not important, then I've seen many people who have suffered so much as a result of diabetes. Seen so many people, even some of them ended up leaving this world because of ignorance. So get yourself to the hospital, get diagnosed, get on the board. All right? Get on the board and have yourself treated. So having said that, again, I looked at dieting. I said there are some meals, there are some things that you have to eat, and very, very necessary, and it helps you to manage your diabetes. Take, for instance, if you go on low carb, I want to tell you to as if maybe you should no longer take carbohydrate. No, you can take carbohydrate, but always take it in small quantity. Whatever you eat, in fact, that's how I do mine. I can eat anything, but whatever I eat it in small quantity. Okay, I eat it in small quantity. If it has carb, I eat it in small quantity. Then I make sure I eat more of the balanced diet. Okay, you can, eat these things mix it with protein, a lot of vegetables, lots of vegetables. Anytime you want to eat rice, someone like me, I like rice, but I eat it with lots of vegetable, and I eat very small portion, very, very small portion. The rest will be made up with, you know, lots of vegetable. Then I put avocado pear. I love it a lot. I put you know, a lot of protein, not only beans, because beans, like I said, is not just beans is a lot of carb inside beans, but you put beans and you put some meat, especially poultry, right? You put poultry, and then make sure that your meal is balanced. If you are someone who is eating any other, you know, well-prepared meal, you can, you know, sort of make sure that it's balanced. I don't know where you are watching me, whether you are in Africa or you have your recipes, you have your different dishes. What I'm saying is that you eat whatever you eat in moderation, knowing fully well that you don't have to go so hard on carb, and you don't have to go so hard on yourself by starving yourself with the good nutrients that come from some certain meals because you don't want to eat carb. All right? So be careful about that. In Africa, we love, especially the part I come from, I'm from Nigeria, we eat a lot of swallow. So this could be gari, this could be semolina, this can be wheat, this can be what do you call it? There's one that I love so much. They call it it's the mostly delicacies of the Yorubas in Nigeria. It's a brown amala dudu. I love that one. And some people eat amala fufu, which is the white one, elubo, and all those things. Yeah, you can eat them with lots of vegetables, you know, even lots of leafy vegetables, you know, like ewedu. You can eat them with the pumpkin leaf. You can eat them, you know, with potato leaves, you know, cassava leaves, whatever you eat in your area, right? Oha leaf, that one, according to new study, is, you know, it helps in making sure that you you know, you are not anemic. It builds blood. Okay, it helps in building blood. I don't know. I didn't carry out the study, but I watch, you know, people say it. Okay, and then you eat fruits. A lot of fruits. You can go up with kiwi. Is good. Apple is wonderful, so excellent. Apple, all right. You can eat the berries. Not mostly the grapes. The grapes are so sugary. All of them have sugar, yeah, but you know, the grapes, something to do with high sugar. But the berries, like the blackberry, like the blueberry, like the strawberries, they're all good. Okay, then avocado is essential oil. It's good, very, very good. All right, so when you want to take banana, just take like one, and you might take it in the afternoon, right? You can take it in the afternoon, not in the evening. Whenever it's getting towards evening, make sure you even all these fruits I'm talking about, eat them before you eat your food, not after meal. Eat them before you eat your food and take your medication. For those of us on statin, so the statin is the last thing you take before you go to sleep, if statin is prescribed to you by the doctor. If statin is not prescribed to you do not take it. Do not say, oh, this my friend is using metformin and is using this, I have to. No. Only take the medication that is prescribed to you. Your own medication prescribed for you and to you only. Don't ever say, oh, someone told me, oh, I can use sitagliptin, I can use this and use that. No. Who told you? Only the doctor, right, can prescribe that for you. And he will prescribe the dosage, whether you're going to take this amount of dosage or that amount of dosage. Don't just go ahead and begin to take anything you like. Oh, this one is good. Oh, yeah. My friend takes metformin. He takes 6 tablets a day. I'm going to follow him to do that. He takes 2 tablets a day. I'm going to do the same. Oh, no, you can't do the same. You cannot do the same. You have to follow the prescription given to you by your doctor. Don't just go and put yourself in a mess. Don't do that. If you take the wrong medication, you are in trouble. So don't follow anybody to do what they... Yeah, you can follow somebody to eat. If they say, okay, you know what? I eat before 6 o'clock. Yeah, that's what I practice. 6 p.m. After 6 p.m., I don't eat. So when you eat like 6 p.m., the worst is 7. Because the digestion is very slow. If you're having diabetics, most times you have slow digestion. Okay? But what those things do is that when you eat like 6 p.m., in the following morning, you have a lot of energy. By the time those nutrients enter your body or whatever mechanism, I don't know, I'm not a doctor, medical doctor. So, but what I know is by the time you eat like 6 p.m., then your life is very much better in the morning. The numbness and the tingling and all the tiredness that happen to you, neck pain, this, that, makes you as if you want to go back to sleep, you never wake up, those things will gradually reduce. All right? And you don't see yourself adding so much fat in the belly region, belly fat and all those things, it begin to fade away. If for example, you are diabetic and you have a lot of weight, one of the things to do is to see if you can lose those weights. If you can lose those weight and reduce it, then it helps you in management of your diabetes. Okay? I don't know how that works, but it helps you. Really helps you. Because you can't be obese at the same time, because especially type 2. Most of the things that cause obesity also contribute to diabetics type 2. Okay, so and it's a lifestyle, because you sit down, you eat a lot, and once you are in that situation, you can't blame yourself, because your body demands so much sugar and goes. Such a thing might be very, very inimical to the management of your diabetes. Inimical is not good. So overeating is the enemy of your health, enemy of your body. Not too good. Yes, not too good. Okay. So just eat minimally. All right, and make sure you eat the right thing. Exercise. I will emphasize that. Do at least between 7 to 12,000 steps a day. Most of the time now, the kind of phone we use, we help you record those things in the app. There are some apps that will help you record, such steps. Okay, so it helps you. And then even, some of the apps will remind you of your drug, just in case you don't, so that you won't miss your your medication intake. Using the drugs sometimes sound negative. We are talking about medication here, diabetic medication. Please forget about using that word. Okay, diabetic medication. So some of those apps remind you, have you taken your medication in the morning? Have you taken your medication in the evening? If you are taking it 3 times, they can ask you that 3 times. That's modern technology. That's technology helping us. Okay? That's technology helping us. So and what that happens, what that means is that now you begin to take your medication on a particular time. Let's say in the morning. The app reminds you 7 o'clock. Have you taken your medication? In the afternoon, reminds you by 2. Have you taken your medication? In the evening, it reminds you by 6. Have you taken your medication? So all these things are how technology help us in this time. But before, again, most of the diabetic medications are highly dangerous when you take overdose. All those medications need to be taken strictly according to the dosage prescribed by the doctor. Don't go yourself say, okay, one thing, I took sitagliptin yesterday. I took one tablet, and I felt better in the morning when I woke up. I felt better. No. Don't feel that way. Or you say, I took 1, then I'm going to take 2, so that I will be much better. Don't feel that way. Medication is not about if you are better or not. Medication is by obeying and abiding by the strict prescription. There is a reason why you take that, why the doctor says you should take 1 tablet. Don't take 2. Don't take half. Don't omit. No. The doctor says 1 tablet a day. Don't take 2. Don't take 3. Don't take half. It's 1. 1. A lot of us, make this mistake, and the consequences it's just terrible and horrible. So don't pin yourself down in all those things that you think that you can do self-medication. No. Just stick to this channel. Subscribe, like and share. Put down notification for more healthy tips on managing diabetes. Like I said, all I'm saying here is practical experience as somebody who has managed diabetes for like 3 decades. So I know what I'm saying. I'm not saying this for gainsaying or, just try to distract you. I'll say, oh, I'm just managing. No, I'm just trying. No, these are things I've tried. Someone might tell you, oh, this medication is not good. People have done this. Don't stay up to 10 years. Don't stop. I've used the same medication for more than 30 years. So why don't you stick to what doctor told you? I have opportunity of using herbs. I have opportunity of using some things, extra. But I don't want to use it. I want to stick to what the doctor, prescribed to me. I want to make sure that I do what the doctor says is right for me. When I do them and it doesn't work, then I go back to him and say, listen, doctor, it's not working. Sometimes they either reduce your medication or increase it. And don't just do it by yourself. Don't reduce, don't increase by yourself. Let the doctor increase or reduce your medication. There is a reason. And those of us in this part of the world, in the Western world, we diabetes, you know, you go every 3 months or 6 months to do blood tests to check so many things, the impact of diabetes to your life, to your well-being. They check your hemoglobin, they check your leukocyte, they check your red blood cell, they check your white blood cell, they check a whole lot of things to make sure you are doing well. And every year they also check your eyes to make sure you are not getting blind as a result of diabetics. And if you have issues maybe with your function as a man, you speak to your doctor. If you have issues with how your body feels, you know, as a woman, or maybe as it affects you in one way or the other, speak to your doctor. Because diabetes is not only for men. But when we talk about it, the impact is more to the men than the women, because a lot of men that have diabetes have what we call erectile function dysfunction. So and this is just due to poor management of diabetes. When you see yourself having that erectile dysfunction, you need to go to the doctor. They have questions to ask, they have remedies to prescribe in terms of medication, in terms of lifestyle. Okay, so like I said, I have a lot of things to say concerning the kind of food that you eat that will help you, the kind of lifestyle that you do. After this particular video, I'm not going to do a blog video again like this, because maybe it will be so boring to you on everything. But if you are actually passing through diabetes, you will have time to watch this video to the end. You even need more. Okay, you see that at the end of the day, I have taken time to enumerate all these things. I passed through all of them. The way it affects you as a human being, the way it affects your dieting, the way it affects your sexuality, the way it affects your health, the way it affects your blood, the way it affects so many things, your social life. But I'm going to be breaking them down from time to time. I'm not going to be tired talking about diabetes. I'm not going to. Many people are losing out through diabetes. Many people, when they are, before they are diagnosed, because they don't even know, one better part of their life have gone. You see them get emaciated. You see them lose. You see them become so frail. But diabetes is not like that. It shouldn't be that way. You can manage it. You can do your job. You can do what others are doing. You can lead a good life. You can enjoy your social life and contribute to the society. All right? There's so many things you can do. Don't feel so bad. Don't feel depressed. No need. All right? There is nothing wrong with you. It's just the same sickness everybody is having one way or the other. If you don't have diabetes, perhaps you might have another thing. So don't feel that you are the odd one in the society, no? Go out there and enjoy yourself, but enjoy yourself in the right manner. All right? Eat well, drink well. The best drink ever in this life is water. Water. The best drink ever in this life. Try the fruits Okay? Try the fruits. Try the vegetables. Undertake exercise. Not heavy ones. Light ones. When you go to the gym, there are some light, and don't overdo things. Don't compare yourself with any other person. Please, don't compare yourself. Take things lightly. Step by step. Things lightly. Don't go and do more than what you can do. And when you go into the football pitch and you begin to dribble everybody from your goal post to the other one, and when you score goal and come, you fall down. When you fall down, it becomes so dangerous. You lose breath. That's so dangerous. Take care of yourself as a diabetic person. Make sure you practice good hand hygiene, good oral hygiene. Make sure you just take care of yourself. You're no different than another person. So many things, like I said, as a diabetic person, you are bound to have a dry mouth. And when you have dry mouth, your mouth smells. It's bad breath. So make sure you rehydrate your person. You know, make sure that you drink water. And then you feel better. You won't have the dry mouth. Okay? Make sure you eat before 6 o'clock to avoid acid reflux. When you sleep, make sure you sleep well. Don't sleep so awkward, or so don't sleep in such a way that you have everything come up, regurgitate, onto your, back into your mouth. You see things come back into your mouth. And then the smell is awful. And then when somebody complains, you go into depression and say, oh, this person is talking about me, saying that, oh, my breath is terrible, and this and that. If it's your partner, you begin to look at the partner, you have no respect, blah, blah, blah. No. She's saying the truth. When you have acid reflux continuously, my dear, even if you brush 10 times a day, your mouth is gonna smell. So the best thing, eat before 6 or by 6 or by latest by 7, and then brush at night before you sleep, and then once you wake up, go and brush, and then you'll be good, ready for the day. Go for regular eye test. Make sure you do eye test to know when to avoid the glaucoma and the rest, okay, that are associated with diabetes. There's so many diabetic related blindness. So you make sure that you see your doctor and see your eye doctor to clear off those ones. You can see your eye doctor once in a year. That should be enough. Okay? And always drink water. Always drink water. And always see yourself as a winner. Don't lose hope. The world is not against you. The world is not against you. The world is not against you. Nobody is better than you. Okay? Take care of yourself and you see people will respect you. Okay? Make sure, like I said, in your social life, I'm going to, talk about my next video is going to be about diabetic and social life. Because this thing is making a lot of people stay inwards. Oh, they say I'm diabetic. Oh, I can't go there. What will I drink? Oh, I will suffer incontinence. I will, soil my clothes. Oh, I don't know what to do. I will stop work. Oh, my joints are paining me. Oh, I'm so much emaciated. What will people say? They will say I have one sickness or the other. Oh, this is happening. I don't know what's going on. Blah, blah, blah. You say all sorts of things. You don't have to. You don't have to. You don't have to. Okay? You are good. You have all the capacity to lead a normal life. All right? Live above average. Enjoy it. Okay? If you decide to manage your diabetes religiously, you will overcome. You will succeed. And will enjoy yourself. Okay? Until I come your way next time, this is Patrick on behalf of Ebuzo Corner saying thank you for listening. If you have any comment, you can leave in the comment section. If you have not subscribed, it is the first time coming across this, please subscribe, put like and share to help someone who might be new or have just started managing diabetics, and then click on the notification button, and whenever we make a video on this kind of discussion, you will be the first to get the video. Thank you and God bless you for listening. I sign out now. Bye.